The H1N1 swine flu has, as predicted, spread worldwide and infected more than 1 million Americans. But it has not become the deadly pandemic many feared, at least not yet. And today, the government recommended that schools with H1N1 outbreaks this fall stay open. The government guidelines were issued as U.S. trials begin on a vaccine. Here's Lisa Stark.
In Seattle late today, the first U.S. trial of an H1N1 swine flu vaccine got underway. 7 other vaccine centers start their trials next week. A vaccine isn't expected until at least mid-October, so today the government released new guidelines for schools on how to deal with an outbreak now.
And we want schools really being thoughtful about this. If there are a handful of children sick, let's keep them home. Let's keep the schools open.
For students and teachers who become ill, isolate them with masks until they can leave school. Clean areas that staff and students regularly touch. Emphasize hand washing.
We're, thinking that a wave will happen in October.
Kim Dockery fully expects swine flu will hit her suburban Washington school district. They're bringing in masks, more hand sanitizers, and moving up lessons on hygiene, hand washing, and covering your cough.
Normally, when would you teach the health curriculum?
It's taught throughout the school year at different times in the health and PE curriculum.
But this year?
This year, we're going to front load it in the first 2 weeks of school.
The government stressed today that if swine flu becomes more deadly, then schools will have to take more drastic actions, including actively screening students for fever and other symptoms.
A big challenge for many schools, which lack adequate health staff. Only 45% of schools have a full-time nurse. 25% have no nurse at all. The rest, just a nurse part-time.
They may have her for a few hours a week, or they have a nurse that's responsible for 4, 5, 6, 7 schools.
Making responding to a health crisis all that more difficult. Lisa Stark, ABC News, Falls Church, Virginia.